Ever wondered what makes you bend, twist, and move with ease? The answer lies in arthrology, the science of joints. So in today's video, we are going to dive deep into structures that make movement even possible. I am aware in two previous discussions I told you, like, one among the functions of the muscles is to move different parts of the body and the body as a whole. But without joints, these movements are not possible no matter how strong your muscles are. In Swahili we say dancing without bending your knees. Cheza bila kukunja goti. You know why that one is hard? It is because the joint should always be there to allow movement. What's up, ladies and gentlemen? Welcome back to NeuroSketch with Dr. Ken, and today let's talk about joints. It will be divided into two videos, and this is the first video, and this is how we're gonna move today. And without further ado, let's dive into terms that are worth noting. So number one is a joint. Joint is also known as articulation, and articulation is a union or a junction between two or more adjacent bones of the skeleton, okay? And then we have a famous terminology here which is known as the ligament, and the word ligare in Italian means to bind. So a ligament should always be there to bind one bone and another. So it is between two bones. It binds one bone into another. So this is just a dense irregular or dense regular connective tissue. But I guess you already noticed the difference between the ligament and the tendon, because I told you the tendon should always be there to connect between to bind a muscle to the bone, but a ligament is binding one bone into another. So ligament is between bones and the tendon is between muscle and the bone, okay? And then we have something known as cartilage, which is a flexible connective tissue which is found in joints, some ears, nose, and some other parts of the body. And these cartilages, they are formed by specialized cells which are known as chondrocytes. All right, so it is important to note that even though joint is a junction between two bones, but it is important to note that the two articulating bones, they should always not make contact. So there is no direct contact between the articulating bones. Okay, a joint is the junction between two bones, but the bones are not in contact with one another. Okay, there should always be something to intervene in between. So that thing can be a gap or can be a material, solid material, or sometimes fluid. Okay, so for example, this is the bone, in between you see we have a material. Okay, material and I've told you there should always be something to intervene. Okay, so this is the bone, in between we have a material, this is the bone, in between we have a material, and so on. Okay, so the muscular strength, the strength of the muscle defines the stability of the joints. So if the muscles around the joint are very strong, means the joint is always more stable than the joints without these strong muscles. Okay, so the word arthrology comes from two words: arthro, which means joint, and logos, which means study. So simply arthrology is a scientific study of joints. So we have a classification of a joint, and we have a lot of different bases of classification, but the two famous are histological and functional classification. So under histological classification, the bones are classified based on the materials, the predominant tissue that make up the bone. Okay, and on functional classification, the bones are classified based on the degree of mobility, the degree of allowing movement, the degree of mobility, the degree of permitting movements of the joint. Okay, so in histological classification, we have different materials that makes up the bone. Okay, number one, we can have solid material, or we can have a gap or fluid. Okay, so we have a fibrous joint. Under histological classification, now we have fibrous joint, we have cartilaginous joint, and we have synovial joints. That is histological classification. But on the functional classification, depending on the degree of the movement, the degree ability to allow movement, we have the synoarthrosis, which is a movable joint, and then we have amphiarthrosis, which is slightly movable joint, and we have diarthrosis, which is freely movable joint. So I want you to pay much attention here. Like, we have a histological classification based on the tissue, the predominant tissue that make up the joint, but we have functional classification based on the how flexible the joint is. But it also happens that most of the fibrous joint, they are immovable. Most of them, they are immovable, so they have like reciprocal reciprocal relationship. Okay, so most of the fibrous joint, they appear to be immovable, or most of the immovable joints are fibrous joint in nature. And same applies, most of cartilaginous joint, they appear to be slightly movable, and most of the slightly movable joints, they are cartilaginous in nature. Same applies to the synovial. Like, most of the synovial joints, they are freely movable, and the freely movable joints are synovial. So we have two classifications, two basic classifications, and they have a reciprocal relation. Okay, so in the histological classification, so today we're going to discuss the histological classification, which is like relevant clinically. And then we have the histological classification, the first two joints, the fibrous joint and the cartilaginous joint. The two bones are brought together by a solid material, a solid mass. Okay, and then in synovial joints, the articulating bones are separated by a gap, or a cavity. We call it the synovial cavity. So there will always be a gap in synovial joints. So we're going to discuss each one in turn, and let's now start with the fibrous joints. So the fibrous joints, as we've said, they are also known as synoarthrosis because they are slight. Most of them, they are immovable, and so the articulating bones in fibrous joint, they are brought together by a solid mass, as we've said, but this solid mass appears to be a dense irregular connective tissue. But note that the fibrous joint, they lack a joint cavity. Why? Because they've said the joint cavity is a characteristic feature of synovial joints, as we have seen. Okay, so the fibrous joint can further be classified, be divided into suture, gomphoses, and syndesmosis. Sutures, gomphoses, and syndesmosis. And now we are starting with the sutures. So sutures are actually very unique, because sutures are only found in the bones of the skull. Okay, the bones of the skull. So it is very, very unique. Like, you're not gonna find sutures anywhere else apart from the bones of the skull. Okay, so you can see, this is the bone, so they are being interlocked together by a suture, and suture. So in the suture also have the bones are connected by the sutural ligament, which is a fibrous joint, as I've told you. And you should always remember that the two bones should never come into contact. There should always be something to intervene, and in fibrous joint, the material that intervenes the bones is the fibrous ligament or fibrous connective tissue. So for example, this is sutural ligament. And so as you can notice, like, most of the bones of the skull, they have like irregular interlocking edges. And this is to add the strength and the stability of the suture, So the sutures, they allow they act as a shocking absorber when the head is experiencing stress. All right. Okay. So they are also important for growth. So as I've told you, most of the fibrous joints are immovable. Most of them, they are immovable, but the suture can be immovable or slightly movable. The sutures can be immovable or slightly movable. in children, in children, and in infants and children, the sutures are slightly movable, but in adults the sutures are completely immovable, okay, in adults. Okay, so why are the sutures movable in children? So they are movable for two reasons. Number one, the very number one reason is for easy passage through the birth canal. Okay, when a baby is during delivery of the baby, so the head, sometimes it happens that the head of the baby is bigger than the size of the birth canal. So what happens, the sutures are always there, like to act like compressible parts to allow easy passage, the head of the baby to be accommodated in the birth canal. So that's the very importance of having sutures in first press. Okay, otherwise if you had a rigid skull from during a uteral life, and then it would be hard for you to be born through the birth canal, because sometimes the birth canal is smaller than the size of the head of the baby. Okay, that's the very number one reason. And then number two is to allow growth of the brain. Remember, you are born with this size of brain, with this amount of the brain, and I know you wouldn't like to grow with this with this small amount of the brain. So you need sometimes like your brain to grow. Okay, so how would the brain grow in a rigid skull? So it would be impossible if the skull was rigid in first place. So there was no room to for the skull to grow, and so the sutures are always there to give that room for the skull to grow, and so that the brain grows inside. All right, so we have the junctions, we have the spaces that are left by the sutures, and we call them fontanelle. So these are the two most clinically relevant fontanelles. So this is anterior fontanelle, and this is posterior fontanelle. See, a baby is born with two frontal bones, for example, this one, but these bones sometimes they fuse to form one bone. So this is the frontal bone now, which is one bone, and it was separated by two metopic sutures, into two bones, but now it is fused into one bone, and this process is known as the synostosis, whereby a joint is replaced by bones. The joint is being replaced by a bone. All right, so let's now dance into the second category of the fibrous joint, which is the syndesmosis. So the syndesmosis is also unique. Why unique? Because in syndesmosis, the fibrous joint that is connecting the two bones, it is wide, it's a broad sheet. It's a broad sheet like fibrous tissue, like this one. And so this joint, we call them the intraosseous membrane, between osseous bones. So these are the fibrous connective tissues that are broad like, and the membrane like they cover, they connect to adjacent bones. So they are found in the between the tibia and fibula. So this is the tibia fibula, and also between radius and ulna, and they also act as the site for muscular attachment, of muscles. We discuss them sometimes later. So the syndesmosis, they are amphiarthrosis, as I've said, so they are slightly movable, but the degree of mobility varies across different types of this joint. So these are the example of the syndesmosis. So lastly, let's discuss about gomphosis. Gomphosis is also unique. So you see these fibrous joints, it's a group of joints which is a group of unique joints, because everyone is unique. So there's no anywhere else you're gonna find gomphosis apart from the joint between the tooth and the alveolar and its socket. So we have a socket here, and then we have a tooth. Okay. So these joints, they are also known as the dental alveolar joint. Dental means tooth, alveolar defines the alveolar circuit. This is the alveolar circuit. So this is known as kyphosis, and there's no other way we're gonna find kyphosis apart from this dental alveolar joint. Okay, so in this joint, you see we have like a little bit dense connective tissue here, which is known as the periodontal ligament. Peri means around, donto means tooth. So this is the ligament around the tooth, which is known as the periodontal ligament. This ligament, what the function of ligament is binding. So it binds tooth to the alveolar socket. Tooth to alveolar socket. Okay, so sometimes you can have like this ligament can be inflamed, as in some inflammatory reactions, and so it may become loose. So when you have a loose tooth, it signifies that you have problems with this ligament. So when your tooth is loose, it signifies that there is a trouble with that ligament. Okay, so that's number one part completed. That was the fibrous joint, and we are moving into the cartilaginous joint. Just from the name, cartilaginous joint, the articulating bones that are brought together by a cartilage. Okay, so for example, this is the bone, cartilage. This is the bone, in between you have cartilage. This is the bone, in between we have cartilage. This is the bone, in between we have cartilage. So the cartilaginous joint, in cartilaginous joint, the articulating bones are brought together by a cartilage. Okay, but we have two important cartilages that they're making this joint. So we have the hyaline cartilage, and the fibrous cartilage, or fibrocartilaginous fibrocartilage. Okay, so we have the hyaline cartilage and the fibrocartilage. Okay, or the fibrous cartilage. So the cartilaginous joint can further be divided into two groups based on the type of cartilage which is found in the joint, whether hyaline cartilage or the fibrous cartilage. So the cartilaginous joint can be divided into primary cartilaginous joint, in which the cartilage present is hyaline cartilage, or the secondary cartilaginous joint, in which the articulating bones, they are brought together by a fibrous cartilage, or the fibrocartilage. Okay, so the primary cartilaginous joint, they are also known as synchondrosis, and the secondary cartilaginous joint, they are also known as symphysis. So we are starting with this synchondrosis, which is the primary cartilaginous joint, and then we discuss the secondary cartilaginous joint, which is symphysis. So synchondrosis. So the synchondrosis, which is also known as the primary cartilaginous joint, they are articulating bones that are brought together by the hyaline cartilage, for example. And this one is a cartilage, it's a hyaline cartilage, this is hyaline cartilage. The synchondrosis, the primary cartilaginous joint, can further be divided into temporary cartilaginous joint and the permanent cartilaginous joint. Temporary cartilaginous joint and the permanent cartilaginous joint. Why temporary? It is temporary because this hyaline cartilage will later be replaced by a bone. Okay, for example, this is the growth plate. And the growth plate is there to allow movements. To allow growth. So this is found in children. So the children, they have these growth plates which are not fused, so they allow growth of these long bones. And then sometimes later, when the growth ceases, and these cartilaginous joint, the growth plate, which is cartilaginous joint, which is hyaline cartilage, which is primary, is temporary hyaline cartilage, will be replaced by a bone. And the process we have said, replacing the joint by bone, is known as synostosis. So that's the primary. It's a temporary cartilaginous joint. And then we have permanent cartilaginous joint. The permanent primary cartilaginous joint. Okay, this is another example of temporary cartilaginous joint, in which, for example, this is the pelvic bone. The pelvic bone is made up of 3 different bones. So we have ilium, ischium, and pubis, and they meet together in acetabulum, and they are connected by a hyaline cartilage, which is known as the triradiate cartilage, but that one is hyaline in nature. And later in life, this cartilage will be replaced by bones, so that there is no intervening material between these bones, and so there is no joint anymore. Because we've said the joint should, one among the characteristic of the joint is that there should always be a material or something to separate the bones, but these bones are not separated anymore, so they are fused, and that process we've said is known as the synostosis. Okay, so what about the permanent primary cartilaginous joint? So in permanent primary cartilaginous joint, there is nothing to be replaced. Okay, so the hyaline cartilage will retain its nature, and it will always be there, so there is no like something to be replaced. So so the articulating bones that are brought together by a cartilage, which is not going to be replaced anyhow. Okay, so that is it on the primary cartilaginous joint. So let's talk about the secondary cartilaginous joint, of which we have said it is also known as symphysis. So symphysis is also known as the secondary cartilaginous joint. But what's so special about symphysis is because the articulating bones, they are brought together by a fibrous cartilage, or we call it the fibrocartilage. You cannot forget about that one. Okay, so symphysis are very strong. They are very strong, and they have this remarkable ability to resist bending and pouring forces. Bending and pouring forces. So we have 2 types of symphysis. So we have the narrow symphysis and the wide symphysis. Narrow symphysis and the wide symphysis. So an example of narrow symphysis, we have a junction. We have a joint between the manubrium of the sternum and the body of the sternum. So we call it a sternum-manubrial joint. So here we have a very thin fibrocartilage, thin or narrow fibrocartilage, and then a joint between two pubic bones. So this is the pubic bone, and this is the pubic bone. We have a fibrocartilage in between, and we call it the pubic symphysis. So pubic symphysis, it binds together the two pubic bones. It is very important clinically. I'm not going to give you 2 scenarios in which the pubic symphysis is very clinically relevant. So number 1, the pubic symphysis. Sometimes in the pelvic fracture, so we have a fracture at the pubic symphysis. The pelvic, it splits open just like a book, and for this reason we call this open book fracture. So open book fracture. Why open book? Because the pubic symphysis, as I've told you, it is like very strong, and it binds together the pubic bone. So if you have damage, if it is torn out, it means the pubic bones will separate away from one another, so they split open, giving an impression of an opening of the book. And so this fracture is known as the open book fracture. The second scenario, during the breech delivery, when the baby is presenting by buttocks instead of the head, the nightmare, talk to obstetricians, the nightmare here is delivery of the aftercoming head. So this one is known as the aftercoming head, which is most of the time stuck within the pelvis. It is stuck within the pelvis. So this is a nightmare. So previously they used to cut along the pubic symphysis to release the pubic symphysis, so as to the bones could go away, the pubic bones would split away to give the room to increase the diameter of the birth canal, and so that the baby can be delivered without troubles. And this process is known as the symphysiotomy. The symphysiotomy. Okay, so it was like practical back in years, but nowadays it is not practical because of a rising of cesarean deliveries. So it's far better to do cesarean delivery, avoiding all these complications. So that was a narrow symphysis. Let's now talk about the wide symphysis. So the wide symphysis are found between the bones of the vertebral column. So this is the bone in between. You have a cartilage. Okay, this cartilage is fibro cartilage, but it's a wide fibro cartilage, and this is how it looks like. Okay, when you chopping it out and then see it from a spot. So that's a fibro cartilage, which is wide. Okay, so it acts as the shock absorber, and it separates between the bones of the vertebral column, and so it is known as the intervertebral disc because it's between two vertebrae. So it's a disc, like as you can see, and because it's between two vertebral bones, it's known as the intervertebral disc, or the intervertebral symphysis, because the symphysis is the symphysis joint. All right, so guys, we are done with the fibrous joint and cartilaginous joint, and so the last part of this discussion will have a separate video on the side, which will discuss about the synovial joint. So I hope you enjoy this video, but in case you have a question, additional comment, you can always comment on this this video down below. But don't forget to subscribe and share this video to your friends. And we have TikTok and Instagram account. You can always swing by and leave a comment. See you next time. See you very soon.